Hi, everyone. Thank you so much for joining Level Forward this Wednesday. I am Lola Loustaunau. I'm an assistant professor at the School for Workers, and I am really excited to be joined today by Kate McCoy from the Department of Health Services in Wisconsin. Hi, Kate.
Hi, Lola. It's great to be here.
Yeah. So to get started, I just wanted to give you some space, Kate, to let us know about the program that you run and the work you've been doing with occupational health and safety here in Wisconsin.
Yeah, thank you so much. So I oversee the Occupational Health and Safety Program at the Wisconsin Department of Health Services, and we are within public health. So we are a public health program that is dedicated to tracking and reviewing information on workplace injuries, illnesses. There are a lot of ways that work can positively and negatively affect people's health. And so that is our role, is to make that tie-in between work and health outcomes, public health. And we do that through reviewing the data, looking for trends, being on the lookout for emerging risk factors for workers, things like that. So we are in Wisconsin. There are other states that have programs like this as well. And we are federally funded from NIOSH, National Institute for Occupational Safety and Health. And if you don't know about NIOSH, it's sort of the sister agency to OSHA. So OSHA does compliance, inspections. OSHA does the compliance and NIOSH does the science, basically. So our program is funded to try to build up the evidence base for understanding threats to worker health and what can be done about it.
Thank you so much for that. And I was going to ask you, so what's the relationship between your program here in Wisconsin and OSHA? Like, how closely do you work together or not? Like, what type of articulations are possible between the two agencies? Because I know those things can be really complicated.
They are, yeah. We are partners with them, like we're partners with many other types of organizations in Wisconsin. So we communicate with them as needed. Sometimes people will reach out to us and we'll make a referral to OSHA. Sometimes there are things that OSHA is called in for and they really can't do anything about it because it's not covered under OSHA standards, but it is a threat to people's health. And so then they will contact us, and really what we can do is provide information, kind of do some education with those employers or with the employees about, what are the health threats, even if people don't have a legal right in that case to address an issue, why might it be important to do so? And we have members of OSHA who sit on our advisory group, just like we have a member of the School for Workers who sits on our advisory group. So that's really the nature of that interaction.
Yeah, and of course, I imagine that, like part of as you were saying, right, part of the substantial work that you do is that it allows potentially in the future for maybe new regulations to be put in place
Right.
based on the type of data that you all collect and analyze.
Yes, absolutely. So we don't want to collect data just for the sake of collecting data. And we don't actually collect it. We use data that's out there. But except for some of the good, juicy talking to people data that we'll be talking about today, Lola. But yeah, we use workers' compensation data. We use federal injury reporting data that we'll be talking about today. And we crunch the numbers and we produce fact sheets and briefs and academic articles. And then we're able to help inform policies and practices. So for instance, OSHA just has, right now they have a proposed heat standard for protecting workers from extreme heat. And it's a very long document in that proposed standard, and they cite a lot of evidence from a lot of different places, and work that we produced in our team is in that, so that's an example of how our work can get used. And as you build up the evidence basis for occupational diseases and hazards, then that also has implications for insurers maybe changing whether they will cover it or not. We also work to try to inform the medical community and general practitioners, folks who are not in occupational medicine, about all the ways that work can impact people's health and the things that they see every day, their lungs, their heart, everything from work-related asthma to blood poisoning. And so we encourage practitioners to know about these things and to ask people about work. And we try to inform managers and the business community about what we're learning, and also produce information that can empower workers to know about what are the hazards they should be aware of, and how can they protect themselves.
And this is such an important liaison role in many ways, right? And like the communication and the education, because as we will chat in a moment, yeah, a lot of what workers find is first that they don't have the tools or they don't have the knowledge. That also sometimes, if we want to think kindly, I think sometimes supervisors also don't have some of the knowledge, and regarding what the rights are, what the procedures are, what the regulations are. And again, also many times medical professionals fail to have the tools to see that something might be workplace related, and workers might fail also to say that for different reasons, right?
Absolutely. And I have a lot of compassion for people involved in these systems. There's so many wonderful medical providers who have no time. We know that the healthcare workers are under a lot of pressure and a lot of stress to go fast. And so, it's not about casting blame, but it is about educating as much as possible, because those providers also want to help their patients. They want to get to the bottom of things, right? And so that's where we try to come in and help them solve those mysteries so that they can better advise and treat their patients.
Absolutely. So now I want to ask you to share with everyone, and we'll talk about it, about the project that we did together and where that the idea for that intervention came from. What were you thinking, and how do you connected with us to try to make that possible?
Yeah, Lola, this is so fun, because I'm really, really happy about this project. So, I spoke about, what my team at the Department of Health Services does. We're in the data, we're number crunchers, we're epidemiologists and communications people, health educators. But we're at desks in Madison or Milwaukee. We have some folks in different places, and we're not out in the field very much. And we don't have a huge staff that we can, be pounding the pavement and be every place at once. But we know if we want to understand threats to workers' health, and if we want to produce information that stands a chance of making a difference, we absolutely need worker input in that process. And we need it for several reasons. One, because it's just going to be so much richer, if you have people who are the ones who are going to be pushing for changes, in their work sites, if they're the ones who are helping from the start to inform what you're doing. Also, like I said, we're looking at administrative data sets that we are pulling, and it's really great to have those, but they never tell the full story, right? And so hearing from workers gives us a real sense of both how to understand some of the numbers that we're seeing in the data, and also what might be left out and what we need to do to go beyond some of the limitations of those numbers. So we really wanted worker voice, and we're really interested in hearing directly from workers. And the School for Workers has a track record of getting those voices and integrating them. And we had worked successfully with School for Workers earlier in the pandemic, hearing from workers about their concerns and experiences with COVID at work. And so it just felt like this was a great opportunity to use the expertise that you all have to recruit folks from high-risk sectors, and ask them in listening sessions about what are their concerns with health and safety. what are the resources that they use currently when they need help, and what basically do they think that someone in a position like mine and my team's should know. So that was just great that we were able to work with you, and you were able to conduct these fantastic listening sessions. And then I know we also had a great part of the project, which was about building on the workers' compensation trainings that School for Workers does, and getting those materials available and those trainings rolled out in Spanish as well as English. So those were the two main parts of that project.
Yeah, and adding to that, I think, I mean, at least for this, from my side, from the School for Workers side, it was really, really amazing to be able to do this project because it allowed two things, right? It really gave us the time, the funding, the support to be able to develop, for example, like these educational materials for workers' compensation in Spanish, and travel around the state and be able to have those conversations because like this type of trainings, like adult education, is not just, it's not a classic classroom, right? So it's also a moment of listening, because there's usually a lot of experience, a lot of knowledge in the room as well. And, we were able to do trainings with over 140 workers in the past year. And I think a lot of what I realized is that the stories about workers' compensation experiences were also coming out in those times during those trainings, and like just knowing that a lot of workers really were needing more information. So just so folks know, actually, and I think maybe I can share, like, I don't know if I have a picture. Yeah, let's see. I'll share a small picture with folks about, let's see if I can do it successfully. Like my technological skills are somewhat limited. Okay, so hopefully people now can see some of the educational materials that we developed with Kate, with the support of DHS. And basically it's like a 2-3 pager, which is the one on the left side of the screen, that in Spanish, that gives like goes into some detail about workers' compensation rights. And then on the other side, these are really small cards. Actually, they're like personal card sides, that we created, kind of following the Weingarten rights type of cards that workers have to, know about their union rights. But in this case, to know about some basics of the rights regarding health and safety in the workplace, and particularly with using workers' compensation. But this all came through conversations with the workers and with Kate and folks at DHS. And yeah, I just wanted to quickly share that because I thought it's nice to see.
Absolutely. And I'm going to be using those materials in some upcoming trainings that we are doing with workers through another project in December. So yeah, thanks for showing them, Lola.
Yeah. So Kate, now I wanted to like take some time to ask you, we did six listening sessions, again, in different parts of Wisconsin, and we were able to hear from workers in manufacturing, in agriculture, in healthcare, in construction. And I just wanna, hear from you a little bit of the things that, that surprised you, that kind of confirms some of the things that you were already seeing in the data. Like, how did these conversations that we had with workers kind of help the work that you do?
Yes, absolutely. Thanks. It was really invaluable. And you're right, some of what we heard confirmed what we knew, but some of it was really surprising to me. And so just to name a few things, a lot of what I've done in the past is more work with undocumented immigrant workers and in other roles prior to this job. And of course, we have to, a lot of the high risk folks, for health and safety, a lot of immigrant workers are in very high risk jobs. So that was sort of one of the groups that I had more experience with. And so I was really surprised when we were in the listening session with native born US citizens who are unionized, hearing from them how poor a lot of their working conditions were. And I kind of imagined that they were better than that. And so hearing from those very educated, empowered, union folks, how much they have to, what they're being asked to do in terms of scheduling, how much their lives are disrupted by the constant and shifting demands of their work. That was really an eye-opener for me. And I'm a little embarrassed to say that. I'm sure some of your listeners are like, really, you didn't know that? But that's why we need to get that information, right? That's why you need to hear it from the horse's mouth. So that was really powerful. Another thing was I knew that there are gaps in the administrative data that we work from, workers' compensation. We know that that's sort of an industrial accident model. You want an injury with a timestamp on it, and workers' comp is not going to do very much for, most of your occupational diseases and, things that we're really interested in from a public health perspective. So we knew that those gaps were there. But one of the things that I didn't realize as much until hearing from those workers was how much even those accident-based injuries are underreported in the data, in the OSHA reportable incidents and in workers' comp data, and how much effort, at least in some workplaces, goes in to keeping those injuries from being documented. And, from my perspective, it doesn't, if it's not documented, it doesn't technically exist, right? We can't use that information to show the burden of these injuries on workers. And then, of course, at that individual injured workers level, there's an added level of insult to the little injury that people are being told to downplay, something that's very grievous, and they're being denied adequate medical care in a lot of instances. So that was horrifying, really, to hear some of the stories that people came forward with. I think, the other thing from a health perspective, just hearing that even now, a lot of people don't, in practical terms, have access to bathroom breaks. It's not that there's no facility on site. It's that you can't step away from the line. You can't step away from the patient. You can't step away from the customer in front of you. That's a problem that a lot of people don't have the ability to wash their hands. I mean, in terms of disease spread, these are real threats. This isn't just a private affair between a worker and their boss. This can have major implications for the rest of us when, disease is allowed to spread because production can't be slowed down enough to allow people to wash their hands and go to the bathroom. So I think these are really important issues, that we need to pay attention to. And it's not just some worker being whiny and wanting to, malinger or, take time to go to the bathroom. Like, we live in the United States of America. People need to be allowed to go to the bathroom and wash their hands in any country, but this is a pretty minimal ask.
Yeah, just like following on what you were saying, I think that one of the things that surprised me as well, I think I want to say was, we were really talking to workers in really different sectors, so their jobs have different requirements, and as you were saying, we were trying to target different demographics. So some workers that we were assuming were more vulnerable to certain threats or to more dangerous workplaces, and some that we thought were less vulnerable to that, right? And to me, one of the main takeaways from these conversations is that there's some challenges that are so ingrained in the system and in some of the ways in which the work is organized and some of the decisions that employers are making at large, that really cut across sectors and demographics that really most workers are experiencing. And it was one conversation after the other in which this, patterns were clearly emerging. And particularly, I think that for me, again, some things that have to do with like the on-site support that workers have when something happens. And as we were saying, like this issue of underreporting of even those like kind of acute accidents that allegedly the system is better better structure to capture. I don't know if you remember, but it's stuck in my head, like the idea of like the bloody pocket syndrome.
Yes, that did for me too, Lola. Yes.
Yeah, which is like workers, for those in the audience who might not know, some might know what this is, but the idea that, you get injured and you are not even like expected to use the first aid kit, because using certain things of the first aid kit is also kind of like audited. So it could raise an alarm or a flag that's an accident has happened. So workers just put their bloody hands in their pockets, right? Because they don't even want to use like band-aids. That level of like, um, like I guess of coercion, right? Really, in some ways, I wouldn't know how to articulate it differently. To me was very eye-opening. Okay, like you are, and these were workers who really knew their rights, right? Who knew their rights, but also, and this happened in several sessions, like this idea of playing the game. Like, yeah, I know my rights, but I also need to keep my job,
Right.
and this kind of calculation that workers are doing of when to speak up or when not to speak up, and how much can they put up with. And that really changes like the information that we have about what workplaces are really looking like, and what are workers really experiencing, right? And I think that one of the important things is like, how do we create safe spaces for workers to be able to speak up and at least share what's going on, so we can continue crafting, I don't know, like interventions that allow us to really know what's happening, and to figure out how to support workers so they don't need to have their bloody hands in their pockets, among other things. Yeah.
Exactly. Yeah, Lola, that really stood out to me as well. And one of the things that stood out to me about that example is at that point in the listening session, people had already been talking about, all the ways that the companies that they were coming from, again, doesn't mean every company. These are the people who are coming forward to our listening sessions to talk about,
Yes.
bad experiences they had had. So, this is people who have had bad experiences, right? But that in those companies, a lot is done to within the bounds of the law, kind of, avoid reporting, steer people away from outside medical providers and medical treatment, et cetera, to avoid getting it, reported to OSHA. But what was so interesting above and beyond that, about that bloody pocket syndrome example, was an OSHA reportable injury. One of the things that makes it reportable is there's medical treatment beyond first aid. And in that instance, the company was not even letting people use the first aid kit. So I feel like we saw such tremendous overreach in some of these situations. And also how inefficient and ineffective it is in a big picture sense, even for those employers, because there's so much good evidence about, safety pays for itself, and taking care of people pays for itself in terms of, healthy people can continue to work longer and better and are more likely to stay with your company, right? But in a tight labor market, we heard over and over again from the non-unionized respondents that, if they were injured in any way, they were fired. You're injured, you're fired. You're injured, you're fired. And then we were hearing about how it's such an incredibly tight labor market, and it's so hard to find anybody, and people are working extra long hours because everything is understaffed, right? So, I think those are points that we can make when we're talking to employers, that maybe are a little more savvy and thinking big picture about, really some of these practices are shooting your company in the foot, right?
Absolutely. And again, like I think one thing that, and just we'll keep chatting, but I just want to open up, if the audience has any questions, you can use the Q&A and we'll read the questions and I'll ask the questions to Kate. So if you want to at any point write any questions there, we'll get them. But yeah, I think exactly. And another point that you were making, and I think this kind of like contrast, you were saying, okay, it's a tight labor market. And like in this idea, like we heard from workers that they would have surgery and then be called in the next day just so they were in the workplace immediately after. Right. But like the level of exhaustion, I think that we heard from a lot of workers, the mandatory overtime, the really long days, but also the really long weeks with 6 days a week in many work sites. I think that also it's, and very seasoned workers, with a lot of experience telling us like we're making mistakes we wouldn't have made. That it's this, I think one of I think it was like an occupational doctor who was overseeing a series of manufacturing plants, and he was saying, yeah, it's like you'll something that was always there, all of a sudden you don't see it because you've been working for 14 hours and then you fall, or like, or you get injured. And I
Right.
think that's something really important that I don't think it's discussed as much as it needs to be. Mandatory overtime is really dangerous for workers.
It absolutely is. And it's a liability for your company. Equipment gets damaged as well as people. If you don't care about people, you're at least risking your production, your products. And I loved what that Ahmed physician said. I remember he said, when do people get most injured in sports? It's in the fourth quarter. And this is not new. This is so well documented. And of course, everybody who lives it experiences it, as we heard, that as you get more and more tired, all of us make more mistakes, right? And that's not our fault. That's just cause and effect. And so, safety records suffer, production is going to suffer, equipment is going to suffer. But, you're going to have increased risk of fatalities, of amputations, of really serious, serious things. And the other part of that, beyond just those shifts, was the spacing, like you were saying, Lola, too, between shifts and the downtime that people do or don't have. And there were people talking about, sleeping in the parking lot in between shifts, not because they didn't have a house to go home to, they did, but they didn't have really enough time. Some of the people who were maintaining machines. And how, I think from a public health perspective, of all of the other costs that those things have for society, when people can't take their kids in for regular checkups, they can't go into their regular preventative care and make sure that they stay healthy. They can't take care of their aging parents. They can't contribute back to their community because they're always working or sleeping, basically, is sort of what we heard. And nobody's thriving under those conditions. So yes, that was a really clear theme of exhaustion and the risks that come with that.
Yeah, I think a worker was saying, yeah, like if I have one day off by that moment of the week, I'm so tired, I'm grumpy, like I'm not nice to be around, right? And that impacts your mental health, impacts your relations. And I think there was a lot of internalizing that this is what the job is. And we also need to like unpack what's going on there and how, like, because workers shouldn't be internalizing this responsibility that, that this is what it looks like to do your job well, because it doesn't need to be that way. We have a comment from Jim Schlutz in the chat that I'm just gonna quickly read. He says, as both an injured worker and an EOHS trainer, I found most workers are vaguely aware of the fact that they have rights, but if you have knowledge or understanding of specific rights or how to use them and be protected legally, yes, absolutely. The employers seem to be allowed to fearmonger their workers, such that, as you say, workers are afraid to use their rights and likely have never gotten any training on how to use them and protect their job as well as their coworkers and protect their patients and customers. And the bathroom break or drink hydration is a prime example, but also things like OSHA 300 logs, much less how to use them, right? Yeah, and I think to Jim's point, I think that we really found that it was complex for workers to navigate the systems, even if they knew their rights. We're on time, but I just wanted to let you, Kate, say one last thing before we wrap up.
No, I'm really grateful to all the workers who came forward and shared their stories with us. And I'm grateful for the work that you've done, Lola, and that we'll continue to do. We're going to keep looking for ways to incorporate worker voice so that we can hopefully help to contribute to healthier and safer workplaces in Wisconsin.
Yeah, and thank you so much, Kate. And I do want to say, I think that the work that you're doing in your program, is really groundbreaking. And this way of like truly incorporating workers' voices to like a policy making feedback loop is so substantial. And workers were so grateful to be heard to have that space. And I think that, yeah, I just want to like thank you for spearheading this project, for inviting us in. And thank you everyone who was here today to listen a little bit of this. The report will be out soon with all the details of what we learned in those listening sessions. And thank you again, Kate, and everyone those here for joining us today.
My pleasure.
Bye, everyone. Thank you.